You know, when you think of the term hospice, you usually think about, medical specialists coming in, taking care of loved ones at home, but it doesn't necessarily mean that the person is homebound. Well, today we brought in Dr. Andrew Peterson with Southern Care Hospice, and we're going to talk about hospice. How are you, sir?
I'm good. How are you doing, sir?
Well, thank you very much for being here. Tell us about hospice. What does hospice mean to you?
Well, hospice to me is about living. Most people think a hospice is about taking care of the patient whenever they're ill.
Old, decrepit.
Correct. But to me, hospice comes in and we allow the patient to live to the best of their ability and have the best quality of life while they're on our service and while they're going through their journey through death.
Well, what is the difference between home health and hospice?
Essentially, home health and hospice, we have the same teams. We have the nurses, the physicians that are involved in the care, and the social workers. However, hospice, you do not have to be homebound, and we are more of a palliation. We take care of the symptoms and help them with their symptoms and relieve their symptoms and keep them at home.
Well, speaking about symptoms, who qualifies for hospice? What kind of situations does a patient have to be in? Is it necessarily life-threatening, or?
Well, most people think a hospice is cancer-related, and that when you get the hospice diagnosis, it's a death sentence. But cancer, chronic obstructive pulmonary disease, heart failure, heart disease, end-stage HIV or AIDS, all of these diagnoses qualify you for hospice, along with dementia. Normally, when you go into hospice, you have a 6-month or less life expectancy.
Yeah. So, but it's not necessarily true. You deal with, as far as hospice, again, you said people think that, well, it's somebody that they're homebound. They're in their last days or whatever. They don't necessarily have to be homebound.
Correct. They do not have to be homebound. And actually, we like for our patients to be able to carry on and do their normal life activities while they're on our program.
Now, people, again, you talk about hospice. Where exactly is hospice? It's not necessarily in the home.
No, hospice can be anywhere. Most hospice care is done in the home, so it's routine hospice care in the home. However, we have nursing homes or long-term care facilities that we see residents in. There's respite care, which if the family is taking care of the patient or the loved one, and they need a break or they're just worn out.
And you see that a lot because
Absolutely.
Pretty much when it comes to the caretakers, it's either a sibling or it's a loved one. It could be a spouse, and it gets to the point where they can't always be there. They have other obligations that they need to do. So that's where Southern Care Hospice comes in.
Absolutely. Yes, Southern Care Hospice, our team comes in, our team of family members come in to help your team and your family members, and we become family.
Now, you can actually transfer patients?
Yes, we can transfer patients if you're on, as far as from home health to hospice, or if you're on another hospice agency and you choose that you would like to come to Southern Care, we can transfer you, and that's a behind-the-scenes move.
And Southern Care Hospice, they're pretty big.
Yes, we're actually the third largest hospice company in the country.
In the United States. That's awesome.
Yes.
That's awesome.
Yes.
And what area here on the Gulf Coast does Southern Care Hospice cover?
We cover from coast to coast, from Hancock County over to Jackson County, and we have up into Picayune, and we pretty much cover everywhere. And we're actually opening a new office up in Picayune soon. So
let's talk about the different levels of hospice care. What are the different levels that Southern Care Hospice covers?
So that's, as I was saying earlier, you have your routine home care,
right.
And then if symptoms can't be managed, or you're having an active pain crisis or air hunger, we can do continuous team care, so that you have nursing staff or a qualified person come in and sit with you and your family continuously until that exacerbation is relieved. And then if we can't get you comfortable in the home, we can transfer you to an inpatient facility. We have contracts with Merit Health in Biloxi and at Memorial Hospital in Gulfport for inpatient hospice.
You mentioned team. Talk about your team and each of them's duties.
Yes, so we have the hospice is made up of several team members. We have the medical director, which oversees the medical care, which that's what my job is with Southern Care Hospice. We have the case managers, which are all registered nurses that, they become the eyes and ears, and they take care to do the daily care. We also have the nurses' aides, which are more involved with the patient and the family, and then there's the chaplain and the social worker.
And these are all people that they have their obligations basically, and they know where they're supposed to come in.
Absolutely.
And doing that. discuss the benefits of choosing hospice at a very early stage instead of waiting until later.
Well, there's multiple benefits, not only from the healthcare itself, but from developing a rapport with the family and the patient. So, if you choose hospice early, we can help alleviate your symptoms at home instead of having to go back to the emergency room. You develop, and your family develops, a better rapport with our family at Southern Care, and we can be there, and through the journey of death, by the end of that journey, we've become family together, and it's a trusting relationship.
You become close.
Absolutely.
I mean, you're there taking care of this person's loved one in their final days. So, not only are you a physician, a nurse, or what, a physical therapist or whatever, I mean, you become family.
Absolutely. And that's one thing most people don't realize. Not only are we there whenever the patient that we have on the service is alive, we have bereavement services for at least a year after death. So we keep checking on the family and making sure their spiritual and religious needs are met. And we're there, like I said, our family becomes part of your family.
So you're, like you said, you're past that time. I mean, even after there's a loss of a loved one, because
Absolutely.
you become connected.
Yes.
So you can't just after okay, I'm done. You don't do that, and that's a great thing about Southern Care Hospital. Hospice. I mean, to me, I'm always saying, Southern Care Hospice, we're hospice. Now, I'm just thinking this one up myself. Southern Care Hospice, we're hospice with heart.
Yes, and our motto is actually Southern Care Hospice, we're caring as a way of life. So that's our
Close.
motto. Yes, yes.
And again, that's it. Now, if someone's interested in finding out about how they can be a part of Southern Care Hospice, what do they need to do?
If for family, or if you have a loved one that you think may qualify for hospice, it's as easy as talking to your physician. We can also do a community referral. If you call in, we can evaluate, and if we need, if you meet criteria, we can get a hold of your physician and see if they're interested in you, coming on service.
And what are some of the things that you hear, from your Southern Care Hospice families?
From our families, I mean, they love the fact that we're there. You can pick up the phone and call 24/7. They love the care, the compassion, and they're always happy that they've chose to go with Southern Care Hospice.
Because hospice care is definitely not an 8 to 5 job.
Not at all. It's 24/7.
24/7, 365.
Absolutely.
Dr. Peterson, thank you so much
Thank
for
you.
your time. Appreciate that, and enlightening everyone about the many great things about Southern Care Hospice. If you'd like some more information about the benefits of about Southern Care Hospice, the numbers on your screen, information about that website. If you'd like to go there and learn a little bit more, and call them for an interview, talk to your your loved one's general doctor, and find out if you qualify and get some care from Southern Care Hospice.